Good afternoon, I am Gian Rainier Dino, and for this afternoon, I'm going to perform a return demonstration on oral medication administration. So with oral medication administration, this is the most commonly used route, and it is the most one of the most effective routes for medication administration. It is also less expensive as compared to other routes, and also has a slower onset yet a prolonged effect. So we're going to do the assessment right away. We're going to check for any contraindications, such as impaired swallowing or gag reflex. Since we are administering medications through oral route. So may hapon, ma'am. Sige, ito pangalan. Okay. So, Ma'am Raven, ako ang nurse na diya sa Neuron, si Gian. So, umuwas na po, ma'am, if napakay problema sa pagtulong sa mong pagkaon? Wala na. Okay. Makatulong ka? Sige lang. Okay. Sa imong mga tambal, wala ka problema? Pagtulong? Sige. Sige, salamat. So now we have assessed for any contraindications. She mentioned that the patient mentioned that she has no problem swallowing, so that's a good signal to proceed with the oral route. Now we're going to check for the history of allergies, medical history, medication history, and also the diet history. This is to check if there are certain drugs that needs to be contraindicated that might trigger the patient's allergic reaction. So, karon mamuas na ko if napaka-history of allergy, or I mean, if nakay madumduman ng tukar, nakay madumduman na tambal ng tukar yung allergy, tumaran ano.
Usually para sa kalan, like allergic symptom.
Okay. Nagkaroon na ako na paracetamol only, is it? What's yung kuwan, ma'am? Last week taon?
Rice.
Rice? Sudan?
Sabaw.
Sabaw na. Okay. So, current ma'am, umas na po if what's yung last week ito mga natambal?
Ano po siya? Para sa sa buhay.
So, akong i-check there is in chart, ma'am. I-admit ka because i-mention there rin na lapad yung ulo, i-admit ka, and also sakit po na di mo kampakan, natiil. So, ginote lang ako naman ang direct. So, okay. So now we can run a physical exam and also check the lab data again to check. We're going to check the lab data in order to see if the drugs that are about to be administered are contraindicated. And also we're going to run physical exams to set a parameter, or for example, we're going to check the vital signs and also the vital signs to check if the medications will take effect after the patient will intake them. So karon hapon na ma'am, check lang po BP. So kalimot na. So sa right lang po mo. Hindi na ako, hindi na ako, hindi ako, kasama ko ka lang, hindi na ako, comfortable. Okay, thank you, ma'am. Sir, ma'am, check lang po sa, check lang po sa temperature niyo. Okay, ma'am. Sa yung ano niya po. Hindi na makagakan. So now we'll take note of the patient's blood pressure. I assume that the patient will take nitroglycerin for her hypertension. Check some of her. Okay. Paano na ako nagutingong mga? So now we already ran physical exam and also check it. We have already checked the lab data. Now what we're going to do is assess the background or assess the knowledge of the patient when it comes to her medication and her own health. So currently, ma'am, mutana lang ko if kapag nakay idea kung sa'y buhaton sa ibuprofen.
Parang pampers na.
Pain reliever. Okay. Sige, mo ask lang ko if naka-idea o sa buhaton sa nitroglycerin. Okay, hypertension. Okay. So, again, last mo check ko if naka-idea o sa buhaton sa fentanyl. So I assessed the patient's knowledge when it comes to her medications. I asked, the patient knows how ibuprofen and nitroglycerin works, but does not know how fentanyl works. So now, lastly, we're going to assess the patient's knowledge or the patient's preference of her fluid. This is also to help increase the patient's fluid intake and to assist the administration of the oral meds. So, karon ma'am, lastly ma'am, mo ask ko if unsay ganahan nimo immune together with the tambal.
Tubig.
Tubig lang. Thank you, ma'am. So the patient requested water only to go together with her oral meds. So now we can prepare the materials that we are about to need, that we will need in administering her oral medications. So now we are already done with the assessment part of the procedure. We're going to proceed with the planning part. So this is to prepare the medication of the patient. So now we're going to wash our hands first, just to decrease the transmission or avoid, not necessarily avoid, but decrease the transmission of microorganisms. And then what we're going to do is obtain the necessary materials needed. So what I have here are the sample meds. So these are all unit scored. These are all unit scored capsules and tablets. So I'm going to demonstrate how we're going to put this in the medication cup. But I also have here candies. So I have here nips. These are the ones that we are going to administer to the patient in order not to waste any drugs. We have here a medication cup. This is again what we're going to utilize in administering the oral medication. Clean gloves. We have here our tray. So we have here pieces of paper. I wrote my own medication ticket, and also here we have here we have here a sample. I also wrote my own medication administration record. So we're going to utilize this after. Syringe in case we're going to administer liquid medications, and we need accurate and precise calibration of the medication. Again, okay. So after obtaining the necessary equipment, what we're going to do is also check the medication ticket. So I have here ibuprofen, nitroglycerin, and also fentanyl. So recap: ibuprofen is an NSAID or non-steroidal anti-inflammatory drug. We have here nitroglycerin. This is a vasodilator, and we have here fentanyl, which is an opioid. So one medication is through oral, one medication is through sublingual, which is nitroglycerin. The oral med is the ibuprofen, and we also have buccal, which is going to be fentanyl. So now what we're going to do is select the appropriate, prepare the medication for one client at a time. So we're preparing for Miss Raven Dino. So that's the patient earlier. So we're preparing preparing medication for one client at a time to avoid juggling or mixing medications. So again, we're going to select the necessary drugs for the patient. So we're going to take in unit scored tablets. So I'm going to wash my hands for it again. Here are my gloves. So, when it comes to preparing the medications, we're going to utilize a medication cup. So, if the medications come from a bottle, what they're going to do is utilize the bottle cap of the medication, and then we're going to pour the medications from the bottle directly to the bottle cap, and then we're going to pour the medications from the bottle cap into the medication cup. If if the if the medication is unit scored like these. Okay. So we're going to put the pack or the medication the medication directly. So we're tendency is when the patient might refuse, or the tendency is when the patient might refuse, or you have the wrong medication, the medication will be wasted. So if the medication is unit scored, we're going to put it directly in the medication cup like this. Simple. Okay, so next, if there's any impaired swallowing, we can opt out to a liquid formula. But when the physician or the pharmacy does not have a liquid formula or liquid form of the medication, what we can do is grind, or you can do is grind the medication using mortar and pestle. But what we can utilize paper. We can wrap the medications into a paper, inside a paper, and then we can grind the medications. And if the dosage of the medication is more than the capsule or the tablet, we can utilize a pill crusher to break those in half. And if the tablet or capsule is pre-scored, we're going to cut using a pill crusher or pill cutter along the indented line of the pill. So we're going to administer drugs at the same time, or put the drugs that are about to be administered at the same time in the same medication cup, except when a drug needs a pre-administration assessment. So such as drugs that affect your maybe temperature or blood pressure. So also when preparing for a liquid medication, we can utilize the syringe, and instead of like directly pouring the bottle directly pouring the medication from the bottle to the medication cup, tendency is if we hold it to our eye level or put it on a flat surface, tendency is the meniscus or the measuring line of the cup might be inaccurate. So for more to achieve accuracy and precision, we can utilize syringes. Okay, so before administering, we need to check the medication tickets to see if the labels of the drug that we are about to administer and the medications in the ticket go hand in hand. So assuming that everything is matching for the three drugs that we are about to administer, we can now proceed. So I'll put this back. So first check is we can first check the medications. Uh, if we first encounter the medication itself, so we'll check here. So again, assuming this is from the cabinet. So assuming this is from the cabinet, so this is the first check. Okay, just like that. So when it matches, before we put it in the medication cup, again we need to check the labels from the inside the medication ticket and also the wrapper or from the bottle. So assuming that everything is matching, we'll put it in the medication cup like this. Triple check. So this is the third time. Okay, so assuming everything is matching, we have now triple checked the medication, and we can now we can now prepare or administer the drug to the patient. So, okay. Our medication ticket. So I'm just going to put the nips. So again, we can, after putting it in the medication cup, we can check the expiration date. It is our responsibility as nurses to double check everything. So to avoid any placebo effect or any negative effect to the patient's body. So we can check the expiration date, and then after checking the expiration date, we can keep the other drugs. We can keep other drugs from away from other people and also from anyone in order to avoid mixing other medications as well. So now we can already proceed with the implementation or the administration of medication. So we have already prepared the medications and also the necessary equipment. Now what you can do is administer it to the patient. So first, we need to go inside the room and identify the patient. May hapon, ma'am. Kinsa kita pangalan? Okay, sige. So ma'am, breathe in. So ako man itong gakuha ni mo temperature BP kanina ako. Si Nurse Gian. So karon ma'am, matagal because yung tambal since 4 p.m. naman. So, mo ko i-order dire, no? So, karon tagal na ikaw sa, tambal. Okay. So, ang usa ni ma'am, imuhang tunlon, ang usa kay lalong sa imuhang dila, dire. Ang usa ka tambal sa imuhang aping. Okay? Sige. So, tubig ang inom mo. Ako ipainom mo together sa mga tambal. Okay, so para improve sa tigaw. Okay. So now, the patient is already in a sitting position. Now we can help administer. We can now help administer the patient or the medication for the patient. So one will be oral, one will be sublingual, and one will be buccal. Wala sa camera. So, karon ma'am, mamanage yan mo na yung milog sa tambal sa para nagbalik. So, paliw na mo. Usa na ma'am.
Isa sa yung color.
swallowed, since we will utilize the mucosal lining of under the tongue. So assuming that the medication has completely dissolved, we can let the patient drink water. So ano ba tubig ma? So assuming that the medication has already dissolved, we can check the area under her tongue to see if it has completely dissolved. Yes. Lang kung isa, ma'am. Okay, so good job, ma'am. So we need to make sure again to check from time to time the sublingual medication, which we need to check if or to teach the patient that the medication should not be swallowed, because this will again cancel the or negate the therapeutic effects of the medication. So lastly, we're going to utilize the buccal route. So last na tambal, ma'am. Sa imong acting. Okay, so ana lang sa acting. Okay. Ulit lang. Okay, ana lang. Okay, hold lang. Ayaw usapa, ayaw lahat sa acting lang. So for the buccal route, it is the medication is supposed to be placed against the cheek. We're utilizing also the mucosal lining of the cheeks here. This will directly lead, the medication will directly lead to the bloodstream as well as the sublingual route, and will also bypass the liver, which is the first pass effect. So assuming that the patient has already, or the medication has been dissolved, so tulog na kung pag-miss ba ba, ma'am? Okay. Hindi na ka mong inom. Okay. So check na ako mga pag-miss ako pa. Wala pa. Isa yung isa. Okay. So time out. Okay. Returned the patient to a supine position. No? So what we're going to do is inform the patient that we will be back after 30 minutes to see if her situation has improved. So adjust na akong camera, ma'am. Sorry, ma'am. So again, we will inform the patient that we will be monitoring her after 30 minutes to see if her situation or her health has improved after taking the drugs. So since humana naman ka pinuksin mo tambal, ako alam is mabalik na pa after 30 minutes to check if nigamay na ba imong temperature o imong BP, okay? Sige. So now we can now discard all the materials that have been used, such as the gloves. And now we can now face this ticket upside down. This means that the medication has been served. And now you can place also information here that the medication has been administered at this certain time. So after everything, we can discard. We can discard and we will record. So after recording, you can also fill out the medication administration record. And also, if we can see any allergic reaction, if we can also see, we can also see the if you can also see any toxic effects, adverse effect or any side effects, we can record this down and notify the physician. I forgot to mention that when administering the drug, we can take or mention the drug and what it is for. So we'll demonstrate that again. So I'll demonstrate that again. So assuming that the patient has not yet taken the or is about to take the oral meds. So ako lang ipatumar ang unang tambal mo ma'am ni ibuprofen. So mo ni makapagamay sa imong hinana and also makapawala sa laman ng ulo. So palog lang kog tumar. Okay, isa na. Ini lang sa tubig. Okay, thank you. So that is for the oral route. I mentioned the ibuprofen or the generic name and also its mechanism of action. And then what we're going to do is proceed with the next medication. So, kuha nag-isa po diya, ma'am. So, ang sunod na yung tambal mo, muna siya yung imutang sa ilalong sa imuhang dila. Muna yung nitroglycerin. Okay, so muna yung makapagamay sa imuhang BP. Okay, paling lang kong kamay. So, again, we need to check if, for the oral route, we need to check if the medication has been completely swallowed. If for sublingual, we need to make sure that the medication has not been swallowed, but we need to make sure that the medication is staying under her tongue. And for the last route, which is buccal, so palayog na mo kumar last one. So mo ni imuhang fentanyl, okay, kumar lang. Mo ni imuhang painkiller and also pampatulog. Okay. Assuming that the medication has completely dissolved, lig na ko abilis sa mga panahon. Okay. So assuming that the buccal medication has completely dissolved, you can now return the patient to her supine position. Okay. Pwede na kami balik, ma'am. Balikan natin ikaw after 30 minutes, okay?
Thank you.
So, assuming that everything has been recorded and everything has been recorded, let's say 30 minutes have passed, we can now check again her vital signs. So, may hapon, ma'am. So, sige, patungalan. Sige, so karon ma'am, check na ako usap yung mga temperature. Since nilapay naman ang 30 minutos, check na ako usap yung temp up. Then, check ko kasi mong BP after. Okay. Isa lang, ma'am. Kumusta ang yung pamati, ma'am?
Okay lang.
Okay na? Wala na ka na ako ay. Wala na kayong dalaban yung ulo. Yung mong kailangan. Nakakaroon na. Wala ka na tumuting konti ka BP. Sige. So we'll take down those these signs in the notebook after. So lastly, check ko sa BP mo. Hindi kami So now we are taking the last vital sign, which is the blood pressure. So if after, kung nasyang punta mo na after nyung kumarkambal mo gamay ang BP, or paano gali mo, balik siya sa normal, okay? ganyan na ka mo pa. Balik na po ta sa, balik ka na po kaya ka sa sunod na nurse, ma'am. After sa sunod yung mga paano ni Marke. So, makaya na yung magpahinga balik.
Thank you.
Thank you. So, I am already done performing a written demonstration on oral medication administration. So, thank you for watching.